Small veins become big veins. They all join up. And this goes up your leg. If you look on the top or the instep, as we call it, of your foot, you're going to see multiple veins, just like at the back of your hand. They eventually become larger veins and go straight up to the heart again. Imagine these become varicose. And the valves are like this. Over years of standing, over years of having obstruction up above, like fibroids and obese abdomen, something called ascites, where there's fluid in the belly. Anything that causes blockage of the veins flowing upwards towards the heart encourages these veins to become varicose, and it's going to encourage the fluid, the blood, to back up, and that pressure is going to be so high it's going to be transferred down to these tiny veins. And when that happens, you go into capillaries. These veins become even tinier veins, even tinier. These tiny capillaries have gaps in their walls, like a strainer or like a sieve, that when blood is under high pressure, it starts to escape through these little pores, all the way out. What surrounds these tiny capillaries? Skin. Your skin overlies. This is the skin. The skin overlies these capillaries. And remember, you're seeing the veins underneath the skin. Excess fluid that is escaping through these pores begin to accumulate under the skin. And that's what leads to fluid building up under the skin, or pitting edema, or swollen legs. What's the reason for the darkening of your legs? When fluid or blood comes into these capillaries, blood cells they tend to be bigger than the size of these pores. But because the pressure is so great, these blood cells, red blood cells that are supposed to be carrying oxygen, they get squeezed through these tiny pores and they get destroyed and accumulate under the skin. So you have a few of them, or quite a number of them, accumulating under the skin. But these red blood cells do not belong here. They belong in the circulation, in the veins and the arteries, where they can carry oxygen successfully. Because they are out here, they die, and your immune system tries to always clean up the mess. So white blood cells, which are like the police cells of the body, they come and engulf these red blood cells. They eat them. And your blood cell is made up of hemoglobin. Heme contains iron, that's one part, and globin is the protein part. It's very easy for these white blood cells or police cells to pick up the protein and break them down and take them away. It is very difficult to engulf and eat iron that remains. And so iron, if you have ever taken iron, it tends to give you black stools when you take it in excess. So iron is one of the reasons why, let me just put some dots here. This iron, these dots represent darkening of underneath the skin. And it becomes an irritant, which explains the itchiness that some people would feel of the skin. But back to the darkening of the legs, because these are so itchy, it encourages an inflammatory reaction. And if you have an old scar on your knee from when you were young, you would see that scar tissue tends to be a little darker than the surrounding normal skin. So that inflammatory, that constant healing, especially if you try to remove the scab from that wound multiple times, when it's trying to heal, you're going to cause more. You're going to start over the healing process, and it's going to get scarred and healed, re-injured, re-healed, re-injured, re-healed, re-injured, and that causes the darkness of the skin. One, because iron is trapped in the skin, and two, there's ongoing inflammation.